Let's talk about doctors and nurses. People really need to do away with the notion that nurses are just the people who take the doctor's orders. We have uniquely defined roles that encompass two completely different arms of medical treatment. In fact, in a hospital setting, there's so many different teams that have independent input into the patient's care, including all of the techs, physical therapists, pharmacists, the social workers, and more. But at the heart of the patient's direct care is the doctor and the nurse. So let's examine what makes us similar and different. In medical school, doctors spend a lot more time with the theory and the science behind the medicine. We learn less biochem than a biochemist, less microbio than a microbiologist, or less pharmacology than a pharmacist, but the depth of our education is in having an understanding of everything. Out of 4 years in med school, we actually only spend the last 2 years rotating in the hospital, broken up into multiple 6 to 8 week rotations across various departments, mostly to get a feel for the specialty that we would like to pursue. Nursing school, in comparison, gets students out of the classroom much earlier and fundamentally teaches them how to work in a healthcare setting, how to communicate in a hospital, receive and administer orders, and the physical techniques required to take care of a patient at bedside. They, of course, get a similar science education as us, but with much less emphasis on the specifics of every flowchart or disease mechanism, because ultimately that's not their focus. Doctors practice the clinical reasoning side of medicine, determining causality and applying evidence. Nurses work on the holistic side, delivering the care to the patient, communicating with the family in the room, and integrating these psychosocial factors into daily, hour-by-hour management. A hospitalist, like me, is the patient's primary care doctor while they're hospitalized. I'm the attending physician for the patient, and my name is on the chart all the way from when they are admitted until they're discharged. As the doctor, it's my job to diagnose the patient's problems and order the correct treatment, while often adjusting it as necessary. I accomplish this by rounding on the patient and checking up on them every day. Has their physical exam findings changed? Are they able to get out of bed today? Are the labs showing a response to the IV antibiotics that I wrote yesterday? My role is to diagnose accurately, formulate the treatment plan, and take the responsibility for making the complex clinical decisions when the patient's course just doesn't fit into a nice algorithm. Sometimes this involves getting other doctors on board, including specialists like a gastroenterologist, or a surgical team like a vascular surgeon, when the patient's needs are out of my scope. Oh, my pneumonia patient is suddenly vomiting blood, or my leg weakness patient just got a CTA back showing that they have 100% occlusion to the femoral. It's my responsibility to quarterback the patient's care so that I can get them out of the hospital with all the resources needed to keep them healthy. On the other hand, nurses are the ones responsible for actually implementing the care plan that I write, monitoring the patient's status with constant assessments and acutely determining when something is reportable or needs to be escalated. This means actually connecting that IV bag of antibiotics and setting up the pump to deliver the medication. We're checking up on their vital signs multiple times a shift to make sure that everything is within parameters. They are also the ones sticking the patient the most, whether it's a blood draw or inserting a catheter into the bladder. It's always wild to me when a patient just demands that the doctor should be the one to draw my blood instead of just the phlebotomist or just the nurse. As me and like 10 other doctor and nurse VTubers would tell you, you probably don't want a doctor attempting these things over a nurse who does hundreds of these a week. Moreover, they're the last person in the line before an order actually hits the patient. The nurses arguably have the most responsibility to double check before physically administering any medicine. And when those orders might not seem right, they have the training to identify the problem and speak up to prevent medical errors. Nurses also spend a lot more time with the patient at bedside throughout the day, their families, and are responsible for providing patient and caretaker education at the time of discharge, so that hopefully we never have to see them again. There are also different levels of certification in nursing compared to doctors who are required to complete residency in order to gain a license to practice. A certified nursing assistant can complete a program in 12 weeks to work as a CNA. A licensed practical nurse can be an LPN after 1 year of study. A registered nurse completes a full undergraduate BSN degree, which can be accelerated or completed in 4 years. There are also master's, MSN, and doctoral DNP nursing specialties that can be completed with about 5 to 8 years of total training for more higher level duties. A licensed nurse practitioner with an MP can actually work directly alongside doctors and see and evaluate patients in our stead, and prescribe medications with our co-signature. In contrast to the nurse's pathway, doctors are trainees up until they aren't, with limited, if any, ability to stop and get a job or practice without completing the full scope of training. At the minimum in the United States, this is a 4-year undergraduate degree, 4 years of medical school, anywhere from 3 to 7 years of residency depending on specialty, with an optional 1 to 3 years of fellowship for those who wish to pursue further subspecialization. So in total, it takes 11 years at the earliest for a doctor to get their first job. And once you bring the crushing debt of undergraduate plus med school student loans into the picture, it can take quite a while for a doctor to become truly financially situated. Anyway, this is a super simplified version of the things that we go through and practice every day. And there are like a bunch of different tangents that I could have gone down on here after like every other sentence, but basically, get it out of your head that one job is inferior to another, or one just makes less money because it's less valued by the healthcare system. We both have important jobs that we could not get done without the other. And at the end of the day, we are both working towards the recovery of our patients. And if you watch this whole thing because you're interested in either of these careers, I hope you at least have a better understanding of what you're passionate about in healthcare delivery and what you're getting yourself into.